in touch with me about various aches and pains, and I've been talking them through with you. But what I'd like to do is basically give everybody some very simple exercises to keep them going. As you know, among other things, I am a Dorn practitioner, and these are all exercises from the Dorn Method. So the first one I'm going to show you is you need basically a hand towel. That's all you need, or any towel, or just any scarf or anything. This is just one of my head towels that I use for you guys. So very gently lying yourself back on the floor, and I would say the floor rather than the bed. I think it is important to have something stable and firm underneath you. Just gently roll yourself back. Remember to hold your tummy muscles, because that's going to really help any back pain that you have. Okay, just keep your legs bent, because that will really help your back. That won't put too much stress on your back. But what I want you to do is just check out your hips and see if you have, on your hip bones here, just check with your fingers, just check to see if you've got one hip higher than the other. So for me, my right hip is slightly higher than my left hip. And then if you can, straighten your legs out. If it's not too painful, for a couple of seconds, you can just check in and just see what's happening with your feet. So yes, I can feel that my right foot is my right leg is very slightly shorter than my left. Okay, so having done that, bend your knees again, get your hand towel, and again, engage your tummy muscles, lift your knee up, and place this as low down as you can around your bottom, around your sitting bones. And then I prefer if you do this with breath. And then what I'd like you to do is breathe in, and then breathe out. And as you breathe out, I want you to straighten your leg out, and I want you to pull up quite hard with the towel. So what you're essentially doing is realigning your pelvis. And you can just do this and if you feel like it's a bit high, you can just move it down a bit. But I would just suggest that you do this maybe 5 times in the morning, 5 times one side, 5 times the other. When you're ready, just swap legs. Do it another 5 times. Oh, I can really feel that in my left side actually. So these exercises from the Dorn Method are just brilliant, because they're not like an exercise routine, which everybody doesn't do usually after about day 3. I'm just checking my hips here. I can feel that they're pretty much level, and I'm just going to check out in my feet, see what's going on there. I sort of wiggle them around. I can tell that they're actually much more level. So just a simple exercise like that sorts your pelvis out. I'll put some more exercises on. You know what I'm like. I'm a bit like the buses, nothing for ages, and then 3 come at once. Alright folks, keep well, keep safe.